Hello everyone. Today I'm doing a quick update video on Clover Health. First of all, if you haven't already been notified, the company posted that they will be doing the Q4 2025 earnings call on Thursday, February 26th, after the market closes. So, some interesting news. For 2026, CMS finalized a 5.06% increase worth $25 billion. But the real news is for 2027, where the Centers for Medicare and Medicaid proposed policies that would result in a net average year-over-year payment increase of a measly 0.09%, or roughly like $700 million in Medicare Advantage payments. Now, let's make it clear that next year, and that is next year, and currently it's only a proposal, so it's not really something to freak out about. Here's a little quote. These proposed payment policies are about making sure Medicare Advantage works better for the people it serves. This is by Mehmet Oz, the administrator for CMS. By strengthening payment accuracy and modernizing risk adjustment, CMS is helping ensure beneficiaries continue to have affordable plan choices and reliable benefits while protecting taxpayers from unnecessary spending that is not oriented towards addressing real health needs. When Dr. Oz says that it sounds to me like they're trying to nudge value-based care further. Some insurers don't like the potential 0.09% increase. Most investors really don't like that proposed increase, but it might actually be good for us as investors in Clover Health. So let's take a look at the Clover management team. Vivek spoke out on X saying, keep an eye out for who's complaining about the CMS Medicare Advantage Part D 2027 advanced rate notice and who is not. And similarly, Blaine Lindsay, the VP of National Enterprise Growth and Partnerships, posted this on LinkedIn. While others in the Medicare Advantage world are having a bad week, the new CMS risk adjustment guidance has me giddy at Counterpart Health. Counterpart Assistance output fits the new model perfectly, creating the mandatory clinical evidence before coding is addressed. Counterpart Assistant is incubated inside a health plan by doctors for doctors, with the highest PPO HEDIS star ratings in the country. If I'm a plan reeling today, Counterpart is my first call this afternoon. Now, let's get back to what other plans have said. Insurer groups have criticized the proposed rates as insufficient. AHIP, who is essentially the voice of health insurers in Washington, D.C., warned that flat funding at a time of sharply rising medical costs could lead to benefit cuts and higher costs for Medicare Advantage enrollees. The Alliance of Community Health Plans called the proposal disappointing and wholly unrealistic. Without the group voiced, though the group voiced support for the new chart review policy as a step toward curbing coding-driven payment differences, the Better Medicare Alliance said the proposal falls short of what is needed to provide stability for Medicare Advantage enrollees. Even more specific, there's a few companies that actually spoke out as well. United Healthcare. Tim Knoll, the CEO, stated that if finalized, the insurer would be forced to cut benefits for seniors and potentially exit certain markets for the 2027 plan year to protect margins. Humana, because they derive the vast majority of profit from Medicare Advantage, They are leading the charge against the measly rates, arguing it doesn't account for the current spike in medical utilization. And Aetna has signaled that they will prioritize margin recovery over membership growth, meaning they will likely raise premiums or reduce extra benefits like dental or vision in their 2027 bids. While Clover Health's team is hyper bullish on this potential environment, other insurers are drowning and they need a way to make profits. Counterpart Health is the key to their success, and the Clover management team is signaling that. Finally, I wanted to hit again on Clover's earning potential this year. Clover is entering 2026 with significant financial tailwinds based on their recent guidance and massive 53% membership growth announced for 2026. The company is projected to see a dramatic revenue jump. If we apply Clover's average revenue per member, historically around $17,500 to $18,000 annually, the membership growth alone adds roughly $800 million to the bottom line, or to the top line, sorry. Because Clover's flagship PPO plan achieved a 4-star rating for the 2026 payment year, they unlock quality bonus payments. So a 4-star rating generally entitles a plan to a 5% benchmark increase in CMS payments, compared to a 3.5-star plan that they were on the year prior. Instead of just getting more members, Clover gets more money per member. This bonus is often used to either increase plan benefits to attract even more members, or drop straight down to the bottom line to improve margins, like how they are guiding for GAAP net income profitability this year. And finally, the industry saw a base payment increase from CMS of 5.06% for the year 2026. This, combined with all the other tailwinds, could result in Clover Health producing top-line revenue of $2.7 to $2.9 billion, nearing $1 billion more than what we expect to see for all of 2025. People don't see this explosive growth yet, but 2026 will make a massive splash for Clover as they continue to prove their business model and de-risk from the insurance industry by improving the Counterpart Health product adoption. Overall, I am highly bullish on Clover Health. Last week, I sold a handful of puts on Clover, and I happily allowed them to execute in the money to collect more shares. As of early this week, we have been at extreme lows in terms of the stock price, and I personally have been taking advantage of the buying opportunity. So that's all I have for right now. Thank you all for listening, and have a great day.